Good morning, everyone. We'll call this Committee on Aging meeting to order on Tuesday, August 2nd, 2022. Bobby, would you call the roll, please?
Cheryl Hentz is excused. Heidi Bassford-Kirkhoff?
Here.
Julie Kiefer?
Here.
Julie Davids?
Here.
Bryn Seaman is excused. Patricia Yurovets?
Here.
Julie Maslowski? Judy Ritchie?
Here.
Mike Ford?
Here.
Joanne Murphy-Spice is excused. Jean Wallerman?
Here.
Okay. Moving on, approval of the June 7th minutes. Are there any additions or corrections? If not, I'll take a motion to approve.
So moved.
Okay. Moved and seconded. All those in favor?
Aye.
Aye.
Opposed? And were there, let's backtrack under roll. Pat, you want to introduce yourself? And
Sure.
I kind of strong-armed her into this, by the way.
Yeah, Judy strong-armed me into this. I've worked in, at Bethel Home as an activity director a few years back for about 10 years, and I've worked in Milwaukee in some nursing homes. And then I was working at St. Agnes in the behavioral health, and now I have my own little clinic on Highway 44. So I've been involved with with Judy and a lot of different things over the years, and so she invited me onto this committee. So I'm happy to be here. Thank you.
And it's been a real treat working with Pat over the years because we have so many different interests and activities that we either parallel or actually do together. And so I have a lot of faith in what she can add to our committee. So, okay.
And she strong-armed me.
Yes. I believe it was at a fundraiser.
Yeah.
Okay. And moving on, citizen statements, Bobby? Anybody? Oh. Okay, all those in favor of the minutes?
Aye.
Motion approved. Sorry, Bobby. Okay. Citizen statements.
None.
And then public comment.
I had none.
In our presentation, we are having, it's actually on falls prevention, along with a number of other activity type things. Rebuilding Fox Valley, we have Chief Stanley, we have Chip, I believe, and I'm sorry, I don't know who you are.
Paula Condor.
Okay, so if you folks want to take the podium and do your presentation. Andy does have you do have the PowerPoint that we're going to be able to access? Okay, good. Okay, go ahead.
Hello.
Hi.
I'm Paula Condor. I am on the board of Rebuilding Together Fox Valley, and I'm going to give an overview of what we do and who we are. Before I do that, we've got Chip Wood here, who is our executive director, and I think a lot of you know Chief Stanley, Oshkosh. Our mission is to keep homes safer and healthier. We do that because then people can live in their homes longer, which is important as you age. So that's our main mission, make them safer and healthier. The way we do that is through home modifications and repairs, and we'll talk about that a little bit more in detail as Chip and Chief get into it. Our primary focus is older adults, veterans, and persons with a disability who are income qualified. Through that, we have 5 programs so we can achieve our mission and create the home modifications repairs. Our first one is fall prevention. Very large program. We're kind of an example for the fall prevention program and other affiliates of Rebuilding Together, as well as other cities are excited about also doing fall prevention the way we're doing it. So both Chief and Chip will talk about that a little bit more in detail. We also have National Rebuilding Day. It is our largest impact event day. On one day of the year, we have 100 to 200 volunteers that complete approximately 300 home modifications and repairs. So we're helping a lot of people to stay in their homes longer. We also have Building a Healthy Neighborhood, which is a defined effort to focus on one neighborhood. We're working at the Appleton West neighborhood for 3 years, and we'll help any homes that need help if they're a homeowner and low income or income qualified. We also have Community Strong. Through Community Strong, we give other nonprofits an opportunity to apply for home repairs and modifications. In this case, it might be their facility, might be a community facility, but we will go and help other nonprofits and the community in general as well, not just individuals. We also have individual projects. We don't do modifications and repairs just one day of the year. We do them all year round. So people apply. We have applications on our website, and they get approved for needing help in their home, and we'll go in and do the home modifications and repairs. Now, the types of things that we might do might be handrails so they don't fall, might be rebuilding stairs so they're safe. Sometimes we'll look at electrical. We may have to bring in skilled labor for that. Plumbing, painting, landscaping. Really there are a lot of things that we can do to a home. We'll look at the flooring, make sure the flooring is safe. Sometimes you have flooring that's, sticking up here and there, and we'll alleviate that problem so that a person cannot fall. Sometimes it's the air. Sometimes there's mold, and we may have to do mold remediation because that's not healthy to breathe. So again, safe and healthy. All of our services to income qualified people are at no charge to them. Basically, often they can't fix the problems themselves because they don't have the finances. So we do it at no charge to them. Now, there is a cost. There's always a cost when you do modifications and repairs to homes. There's the cost of materials. There's the cost sometimes of skilled labor in the example of like plumbing or electricity. There's staff cost. Staff does, we do training in our office too, volunteers, to learn how to put in handrails or a few other training items. So there is a cost, and the way we cover those costs are through grants, corporate sponsors. We get a lot of corporate sponsors for National Rebuilding Day. They may sponsor a house for $5,000 or $6,000, and that will cover all the materials and the staff time needed. We get funds through foundations, fundraisers. We have our largest fundraiser coming up in October if anybody is interested. It's a Monopoly-themed gala, and we raise quite a bit of money, and it's a Monopoly theme, so we have activities like chance, community chest, things like that. We have a life-size 12-foot square Monopoly board, which is interactive this year, and people have commented it's one of the most fun fundraisers they've ever been to. So it's a lot of fun to do. Let's see, our work. So how do we complete the work? Volunteers. As I mentioned, National Rebuilding Day pulls in 100 to 200 volunteers, and then also skilled labor for things like electricity and plumbing that volunteers shouldn't be doing, especially electricity. And also staff does the work as well. So as a summary, the help that we receive with funding and with volunteers allows more people to live in their homes longer, because their homes can be made safer and healthier. that's a quick overview. And I'll now let Chief Stanley talk about what he's discovered.
Thank you, Paul.
Thanks, Chief.
Good morning. I'm Mike. I'm your fire chief here in Oshkosh, and so happy to be here with you this morning and see a lot of familiar faces. Chip asked me to just do a brief 2-hour overview about falls in Oshkosh, so just hit the tip of the waves here. That in all seriousness, though, very happy to be here and have the opportunity to talk about our partnership and talk about some of the things that are affecting us here in Oshkosh. 4 years ago, when I became the fire chief here, I looked at what do we do in the fire department? What type of calls do we run? What keeps us busy? And what I was shocked to discover is far and away the number one call type that we go on when people call 911 is for a fall. And that is incredibly disproportionate to our other calls, and disproportionate comparably to other cities and municipalities across the country. And here we are, several years later, and I'm still seeing that same dramatic impact. That we run about 10,000 responses a year. Which keeps us busy. But what's staggering is last year over 1,700 of those responses were for falls. And so what's the issue? A few years ago we put together a group of stakeholders in the community, and many people at this table. And out of this group are involved. Mike and Jean and Joanne were involved from the beginning. Start doing some listening sessions and talk about what's the issue. Why are falls so prominent in our community? And our friends from Rebuilding Together Fox Valley also were at that table from the beginning. As we talked to people, we realized there was some misunderstanding, some misconception about falls, and from people that are themselves have fallen or at risk of falling. And we said, what does Oshkosh need to do? What can the city of Oshkosh do to prevent falls? What's causing these falls? And as we started to talk to them, what they told us? You need to repair the streets, the sidewalks, and enforce better parking lots because there's lots of trip hazards there. They're in poor repair, and that's causing us to fall down. I went back and I looked at the data and said, unless you've got a street running through your bathroom or a parking lot in your kitchen, that's not where you're falling down. Far and away, what we're seeing is people 60 years and older are having what we call a mechanical fall. They're tripping over something, or they don't have the strength to get out of bed, to get out of the bathtub, get off the toilet, those type of things, and it's causing them to fall down. And then as everybody here knows, once those falls start, a domino effect starts to happen. That you'll fall, you'll probably continue to fall until you have a significant traumatic event, the dreaded broken hip or broken femur, end up in the hospital. Chances are 50-50 you'll develop pneumonia from being laid up, and then chances after that you develop that pneumonia 50-50 you'll die. That's horrible. Paula talked about we want to keep people in their homes, or one of the missions we had as we put this together was, how do we allow people to make choices? I like to make choices in my life. We all like to make choices in our life. How can we provide that same opportunity for the people in our community, especially the aging population in our community, where they can make choices? Because once you start falling and that progression starts, you have limited ability to make your own choices anymore. So I said, armed with that data of where are the falls happening? They're happening in the bathrooms, they're happening in the house. What can we do to address that? I said, so many people can stay in their house with just a little assistance and some modification. That's where Rebuilding Together has been an incredible partner for our community. If they can come in, they can do that assessment, they look at what the risks are, and they mitigate those risks. Might be as simple as putting grippy strips on the bathtub, might be a little more complex by creating a modification with a walk-in tub, putting handrails next to the bathtub, the toilet, your bed, so that we can reduce those falls. So very excited to partner with them, particularly, as we all know, many people are on a fixed income. And say, oh, well, I'd like to, do a tub modification, but boy, that's super expensive. Well, now we have a mechanism to do that, at no cost to our community members. So incredible program they're doing. They've been a fantastic partner. We look forward to continuing this momentum and raising the awareness so that we can make these interventions in homes. We've got a lot of other programs we're working on. I would encourage you to talk to Jean about what we're doing out at the senior center, that they've really been able to do some great things and been great partners as well, and getting ready to roll out a new program there. And I thank you for the opportunity of letting us come and talk today. I thank you for what you do to raise awareness around fall prevention in the community, and to make Oshkosh a better place to live and a place to live better. So thank you for your time. I'll turn it over to my friend Chip.
Oh, that's what the problem is. What the heck is going on?
I'm able to use a clicker up here, or?
The right arrow.
Right arrow, wonderful too. Thank you so much for the opportunity to present our initiative with the organization. And I have to say what's really successful about this program is this is an example of community partnership, where a lot of times nonprofits will operate in silos, but we're really, really fortunate to have this partnership with Chief and all of his fire departments, with the Aging and Disability Resource Center, Finding Balance Together, and a number of other nonprofits that get involved a little bit. So I'm going to talk a little bit about what exactly we do in the Fall Prevention Initiative, and then we'll kind of direct you to the PowerPoint if you could take a look at this. So we revolved our things on science, what's going to be the most impactful things that we can do to make homes safe and healthy for people that have fallen in their home, and came up with these 5 things that are going to be the most impactful in there. Number 1 is a toilet seat riser. Makes it easier to get on and off the toilet. Number of people are falling trying to do those simple things. Non-slip treads in the bathtub or on the shower floor. Installing a shower chair or a tub transfer bench to make it easier to get in and out of the bathtub. Hanging grab bars, probably the most impactful thing that we're doing. And installing night lights. Additional lighting, such a simple thing to be able to do, is one of the key causes for falls within the community. One of the neat things is that our entire kit, if we were able to do all 5 of those things, costs $250. An additional $250 installs all of those things from all the staff time. We did a very, very detailed time study. So for $500, we're able to keep people safe and healthy in their home, prevent them from falling. This is just an example of what our totes look like before they come out. Like Chief and Paula have said, we have some incredibly skilled volunteers that we go through an extensive training process with to be able to do these extensive home modifications and repairs for people. We take this pretty seriously, and all of us on staff went through what's called the Executive Certificate of Home Modification through USC's Leonard Davis School of Gerontology. Taught us all the specifics on this is how you hang a grab bar, this is where you hang it, and this is why you do it. This is why we recommend this material over this material, and this is why it's going to have a bigger impact in letting people stay safe and healthy in their home. All of our volunteers have to start off by going through a 4-hour training process, and then they'll shadow another volunteer that's skilled with them. After 2 shadows, then they will be observed, and after 2 of those installations, they can begin doing installs on their own. The entire process can take 8 weeks if you go very quickly, but it takes most people 3 months or longer because they like to be very comfortable when they're doing this. When we do a fall prevention installation, we get a referral from Rebuilding Together Fox Valley. And this is where Chief and the fire department or Gold Cross up in the Fox Valley really come in. We couldn't do our program without their advocacy. We've tried going door to door and telling people, this is how important our program is, and we're going to do this for free for you. And like, I don't know if I believe you. There's a catch in here. But when one of Chief's people goes out and says, this is something you need to do, I'm telling you, you can trust these people, they're our friends of ours, then they follow through with us. The referral not only comes to us, it also goes to the Aging and Disability Resource Center, whether that be here in Oshkosh or up in Calumet County, in Outagamie County, or in Waupaca County. The Aging and Disability Resource Center will work to ensure that people have all the resources that they need to prevent them from falling again. Now, that could be a medication review, that could be taking a look at food insecurity, that could be taking a look to make sure they have the proper insurance to have what they have. Maybe it's a vision problem that they've got going on. I'm really proud to say that the people at the Aging and Disability Resource Center have dedicated people that really go in depth for this. They'll make at least 3 attempts to connect with people, and then they'll have 3 follow-ups once they make a connection with everyone to ensure that they've got everything that they need to have success and not fall again in the home. On our end, we'll call the homeowner and set up the installation appointment and once matched with the volunteer. We try to do this in 2 weeks or less. Once you fall, we'll call you, we'll get set up, we'll get someone in there to install our fall prevention team. We'll go over the homeowner's agreement, let them know this is exactly what we're going to be able to do. We'll take them through, and what's really important for us is we don't just say, okay, I'm gonna put a grab bar here, grab bar here, grab bar here. We take an extensive amount of time and say, okay, so first let's put on the toilet seat riser. Now you're gonna sit on this. Where are you going to grab to get up from the toilet there too? And then we'll put a mock grab bar there too. Is this a good height for you? How about if we put it this way? How if we put an angled one in this way? We make it so the person feels safe and comfortable in their home to be able to have that safety and independence. We also ensure that everyone has some additional education. We want to make sure that if we get our hands on someone, if we have that touch with them, we not only refer them back to Aging and Disability Resource Center, we see what other resources we can provide them to. Sometimes they're not comfortable reaching out to Aging and Disability Resource Centers because some people think that it's a government agency, they might be out to get me, or some people are afraid that they're going to get removed from their home if they get involved with this. So we provide another source of support, saying, you know, the people at the Aging and Disability Resource Center are pretty fantastic. They're good friends of ours, and they're very good to be able to help out with. Here's some additional resources out there. Have you thought about finding Balance Together that has some classes that can be able to help you with balance? Have you got connected with a clinic that may be able to help you with some of these things? That I know down in the city of Oshkosh, they've got a balance meter that Chief was alluding to. So we were there to try to make sure if we're able to connect with someone, we make sure to address as many needs as possible for them. And then once the work is completed, we go back and start the whole process over again. Homeowner signs the agreement. We offer them a thank you card, and we offer an application to our Safe and Healthy Housing Program, which allows us to do more in-depth modifications and repairs. So one thing while we're there and we're taking a look at installing those night lights and hanging those grab bars, we take a look at if a person's having some difficulty getting in and out of the tub. Say, you know, if you sign up for this Safe and Healthy Housing Program, we can come in and do this bathtub cutout for you for free. We had an individual that wanted something like that, and she contacted a big box store or someone that kind of is like a professional installer for this. And they convinced her to spend $12,000 to get an all-new walk-in shower unit. We could have done a bathtub cut-in for $750, and it would have cost her absolutely nothing. But now she's kind of scrambling for debt because she got convinced that this was the only way she could stay safe and healthy in their home. The impact of our program is pretty darn incredible. We were just on an install 2 weeks ago where there was an individual that 5 years ago was a senior vice president at Thrivent. Health kind of took a turn for the worse, and she had to resign. And now it's kind of living off of Social Security disability income. And she has fallen so many times up in Appleton that the fire department have asked to put a lockbox on the outside of her home. There was a time where she was down for 18 hours and actually had to get a cat toy to be able to see if she could secure her cell phone to come over and call 911. And this happens over and over again. But she got connected with our program. We were able to go in and in a single day help her regain that independence to be able to do. Just by hanging some grab bars, just by getting her referred to our Safe and Healthy program to get that bathtub cut in, adding some additional lighting, helping her feel safe and healthy in her home and feel more independent. So we got a few little examples of what these look like in action there too, little night lights and some anti-slip grips and dots that we can put on the bathtub floor. Some of the grab bars that we've installed. Shower chair and tub transfer benches there. One of our wonderful volunteers from First United Methodist Church down here in Oshkosh helping us out. An example of this is actually Team Pella. What's absolutely fascinating as well is a lot of businesses like to use our organization as an opportunity to team build, but also give back to the community. So this is Pella Windows doing an executive leadership event where they decided to help us out and at the same time develop that camaraderie, and they actually did 6 installations that day. So what we're hoping to be able to do is we secured a grant for 3 years with the community foundations to be able to fund this program, but grants run out over time. And we're hoping to raise awareness and be able to secure some additional funds going down the line that we're going to need to be able to continue this program. Falls are the leading cause of death for older adults in Wisconsin. You guys know this. I'm preaching to the choir here too. But we're going to need to get some additional funding to be able to support this. So we thank you for the time. We hope you're able to share our good mission and work with some others in the community. Thank you.
Thank you. Actually, if all 3 of you would come back up to the podium and address any questions from our group. I'm going to start with one. that I was asked earlier on from someone prior to this meeting. Do you go into apartment buildings where they don't provide like the grab bars and things as long as management says it's okay? Because, I mean, there's a lot of older people living in apartments that don't have that.
You're exactly right. So number one, if it's not provided, the person that is renting that apartment has the ability to say, you need to do this for me, and by law, they have to do that, but they may have to pay for it. I have not found yet a management organization willing to allow us to come in, and we've had this conversation a number of times with a number of different landlords, and the response is, well, if we're gonna do it, then I'll hire someone to do it, and then they'll pass on that cost to the individual. This is something that we've discussed at the board of directors level, and we're trying to find a workaround to be able to do this that would free us from liability should anything happen, because some landlords are fantastic, others are not. And so we need to find a way to find that balance. So at this time, no, we do not. But the person does have the right to be able to contact their landlord and say, I need to have these installed, and it's something that they have the legal right to have. They may just have to pay for it.
Anybody else have questions?
How long have you been doing this?
This particular initiative,
The organization, how long has the organization been?
we've been around for 22 years.
22 years?
Yes, yep.
Okay.
We just came to Oshkosh 3 years ago.
Okay.
When Mayor Palmieri reached out and said, we'd really like you to come on down to this too. And then we got involved with the original grant through the Community Foundation to do the pilot study.
Okay.
After that, we got together as a group and pursued it a little further and said, hey, this study isn't enough. We need to do something
Yeah.
about it, and brought it there too. So we've been in the Oshkosh area for about
Okay.
3 years.
Do you guys keep track of numbers of how many families or individuals you've helped?
Oh, yes, thank you. So in 2021 alone, we did 788 home modifications, repairs, benefiting 136 individuals in 75 different homes. Specific for this fall prevention initiative, for those 5 specific things that we do, our goal was to do 250. We did 361. In addition, we add on a couple other modifications, repairs that aren't funded by the grant but do prevent fall prevention. That total number would have been 446. This year, look this morning, we're at 668 modifications and repairs with 4 months left in the year. For volunteer hours last year, we did 1,995 hours. That was generating $194,000 in in-kind revenue. This year, we're at 1,991 hours with 4 months left in the year, so we're just continuing to grow our impact. I really like numbers. Yes, I love data.
Well, I really appreciate what you guys are doing. My grandpa, who has passed, he was 94, and he lived in a old house in Madison, with the steep basement stairs. And he tripped over an electrical cord, and he was down for like about a day and a half. And because he was down that long, he spent the next 4 years in a private nursing home. So I really appreciate, if he would have just been educated maybe, or, even us a little more educated at that time, that maybe could have been prevented.
Absolutely.
Can I just say, we're working with fire departments and cities to, when somebody has fallen, to go in and do an assessment and help them not to fall again. Really, what we would like to get to is have a large enough awareness so that we can go into a home and do these preventative measures before they fall.
Yeah.
So, and that takes, it takes funds, it takes awareness, it takes publicity.
Yes,
So that's another side of the story, it's going in before someone falls.
right. Absolutely.
Well, one of the things, a few years ago, there was a collaboration work group with the health department and several other entities. And one of the things that was done was, in working with the fire department, how many calls to certain particular addresses. And sometimes, and I think Chief will agree, some homes, their crew is there 2 or 3 times a day. Isn't that sad? 2 or 3 times a day. And there's 2 words that I use a lot in working with some of the families. denial and stubbornness. Denial that they have the need. Stubborn, I'm not going to have anybody telling me what to do. And not facing the consequences of just burying the problem to the point that it's just repetitive. And it's scary. It's scary. I live in a 55 and up building. The ambulance parks under my bedroom window. So I know what's going on. And I know when it's on my end of the hall of what's going on. So, and if it's that in that little area, what's it like in the entire city or the county? So I think, these initiatives are long overdue and very welcome by many families. They just aren't aware of it.
Just curious, would you say there is a high percentage, or, do you have any numbers on if there's alcohol involved with seniors falling? Do you see that there's alcohol involved at all?
Yes, we look at that, and no. And really, we were able to look through those numbers, and we were able to identify through that research, we call her Fiona Fall Down. It's really our case study patient that it's a female, obviously, Fiona, living in her own home, falling in the kitchen or bedroom. She's around 70 years of age, has not been drinking, and has had the general complaint of weakness. And that's the case scenario. That's our most frequent fall patient is Fiona. Is that demographic? So, because that was one of my initial questions: are people just getting drunk and falling down? Is it that the gravity is higher in Oshkosh than other places? What's the issue causing all these falls? We're finding it's around those mechanical falls because they can't ambulate around the house. The lighting is poor. So it's not I'm getting dizzy and falling down. My medications are interacting. Those things all can play a factor, but it's trips and falls. Falling out, getting out of bed, and Judy is exactly right. Where we go, we pick them up, we put them back in bed. They fall down again. We go, we pick them back up, we put them back in bed. It just is a repetitive cycle. And we're completely reactive, like Paula said. Frustrating for my personnel because we want to help people. We're not really helping you. We're continuing the problem. So this has allowed us to make some interventions to go, okay, we're going to interrupt this cycle rather than just having you consistently repeat it until something terrible happens.
I have a question. Is there ever a time when your department visits a home repetitively that you just go, you know what, this person is not safe here? And so what do you do with that information? Do you reach out to APS or the ADRC?
Yeah, if they are, like in a failure to thrive
Right.
type of scenario, yes, we'll reach out to public services, that human services and things like that. But Chip referenced that data collection, this opt-in. So I've been to your house several times. I see we've been here a bunch. I've been here 4 times today. Maybe we need to get you some help. Do you think we could gather some information from you, and some resources will connect with you so that we can find some help for you? So our field personnel, our paramedics, gather that information about your name, and many times we get the child's name, or a caregiver, who's responsible with medical decision making for that person. Where did they fall? What were the circumstances? Their age, et cetera, et cetera. And then every week referral goes to ADRC. It goes to Rebuilding Together, and it's going to go to the senior center. So then they reach out and say, hey, we got your information from the fire department. We'd like to come and visit with you, do an assessment. So hopefully they'll opt into one of those programs. But ADRC will come in, and they were the first group we started sending that information to, and we've had phenomenal results of, sometimes it's a home modification, sometimes it's you need home health care somebody to come visit or twice a week. You might need a hospital bed on the ground floor, so a commode, so you're not going up and down stairs. Or you might need, a different placement for where you're living. That, we've been able to make those resources happen, and we're having great throughput, where they're getting connected with ADRC and they're making interventions. But, one of the things I would add to what Judy said of, her two words about stubbornness and denial, those, yes, we see those two very prominently, but the third one is fear. They're afraid we're here to take you out of where you live now and put you in a home. And that's such a scary thought. Like Judy said, people are scared. So creating those relationships and building that rapport and utilizing, the fire department, because we are interacting with them and trusted to give that warm handoff of, hey, we're here to keep you in your house. We're here to help you make be able to make your own decisions. Has been monumental as we've moved through this program. We're not here from the government to take your rights away. We're here to give you choices and be of assistance. So this, we said, relationship with the fire department and the senior center and rebuilding together and ADRC, has been tremendous. Oshkosh Media has been a huge help with us doing some PSAs and creating some materials and videos and stuff to raise awareness. So it really has been it takes a village type of project in this community to address that.
Any other questions? Thank you very much, because this is something that is an ongoing concern that I think we've had. I can go back to the 70s and 80s when I was just beginning working in aging, or aging specifically. And it doesn't seem like that concern has changed very much, other than there's so many more resources and so much more information out there. But the problem is still there. So, again, thank you.
Thank you for the opportunity.
Okay, moving on. Jean.
Yeah, in conjunction with the fire department, I just wanted to show you a quick little video, and then we are in the beginning stages of partnering with the fire department at the senior center. We have a machine that we just had ordered that measures your risk of falls. So we, Andy, do you have that ready to go? So just a quick little video, and then we'll talk again further about our program and our connection with what we are going to start implementing with the fire department at the senior center.
No pressure, Andy. No, no pressure.
Okay, while we're waiting for that, one more
No, it's,
Thing that
I
I-
just was interested. I'm like,
One more thing that I find is an issue for a lot of seniors. Families will get them the electric lift chair without any rehab or training to improve leg strength. And so that's another cause of falls, very frequent falls, or getting stuck in, partway through the chair.
oh, that happens a lot, especially when we lost power, last week.
Oh,
I
yeah.
heard a lot of my neighbors, being stuck in in their chairs.
There's supposed to be battery backup, but
Yeah,
that's not fail-safe.
yeah,
If
no.
you struggle to lose weight, you must see this.
We don't
A fat
have-
dissolving loophole has just been leaked that can dissolve 59 pounds of fat in just a matter of.
For static and dynamic balance assessment and conditioning, Biodex brings you the Balance System SD, a multi-purpose therapy device that enables balance testing and training for the broadest range of patient populations. The Biodex Balance System SD is the only system that provides a fast, accurate fall risk screening and conditioning program for older adults. In just 2 minutes, the Biodex Balance System can identify a person at risk of a fall by comparing balance test results to age-dependent normative data, consistent with American Geriatrics guidelines. Biodex Balance Assessment brings together best practices for concussion management, providing a baseline to compare against post-injury performance, helping to inform return-to-play decisions. Balance System SD training exercises can help improve gait and balance issues affecting patients with neurological disorders, including Parkinson's disease, stroke, or peripheral neuropathy. Featuring easy-to-follow touchscreen navigation, the Balance System SD is simple to learn and operate, leading the users step-by-step through testing protocols and training modes, using either a static or dynamic platform. Essential for today's clinician, the SQL database allows you to easily store and retrieve patient data. Quickly export multiple tests for each patient to communicate need, track progress, and document outcome. The Balance System SD offers a selection of single and dual task gaming options to motivate exercise and carry over into daily activities. To maximize functional benefits from balance training, Biodex offers the option of free sway handles. Like training wheels for balance, floating handles help patients feel safe and secure without impeding postural sway. Using wireless technology, the optional vibrotactile system responds with a vibrating sensation when the patient sways outside set parameters, resulting in improved postural control. And all Biodex Balance System SD devices come with the added value of turnkey programs, science-based technology solutions, and marketing support materials to help you attract more patients and physician referrals. The Balance System SD, a versatile balance tool that helps you broaden your applications and increase your clinical value.
So that machine is currently at the senior center, and all of our staff many of our staff have been trained on that machine. We'll be starting to pilot that program probably in the next month with the fire department, referrals from them, as well as opening it up to the public in October. So we're in the really beginning stages of that, and when an individual comes in, they will get assessed on that machine as well as 2 other assessments. And then we'll go through a series of different questions. What are your barriers? What are your needs? And then we will partner with you guys to pass on this information if they need to install grab bars as well. And then also putting them through a 6-week exercise program to help with strength. So that's our connection, the piece of the puzzle that hopefully will help individuals get stronger and be able to stay in their homes longer. So we're excited. We're ready to go. Our staff have been, getting some of the seniors on the machine already just to kind of test it all out. And many of them are anxious to try to see what it does for them. So that's it.
I have a question.
Yes.
Is there any type of literature that we building together can provide to the
Yes.
senior center?
Yes.
What would be helpful to you?
I can meet with you guys another time, and then we can kind of put all of our materials together, so. Good.
And thank you.
Thank you.
Does anybody have any questions for Jean? Oh, okay. Well, then moving on, old business, discussion of the 2017-2019 strategic plan. And here is some information that I pulled together. One of the things that, as Julie and I have been talking over the last couple of months, what the purpose of the committee is, and then with the strategic plan as it was done back in 2017, 2018. Then we had the pandemic, and now trying to just figure out where we're at. So in your packet, the lavender sheet actually goes back to 2012, when there was a very brief strategic plan put together. And it sort of pointed out where we could focus, what were some of the issues. It never really put together a plan of action. And so it just was a piece of paper that sat there. And then, let's see, trying to go through my own packet here. Okay, so, and then when we did the more in-depth strategic planning, which everybody got when they came on the committee, there were actually like 5 areas that were identified, but 4 that we were going to concentrate on. And the yellow sheet shows who was working on that. And if you notice, Jean and I are the only ones left out of the group. And there was some good progress that was being made, but when everything sort of halted, and then trying to come back and not having the same members, not being able to really educate the newer members to what had gone on and what went into the plan, it became rather frustrating. And so with that, we thought we would kind of go down the key points and what do you think we need to be doing? And actually, I think I know what Mike is going to say, so.
Oh, no.
No, that's fine. Strengthening our partnership with neighborhood associations and other partners. And we did a bit. It was going. And Julie, being the chair of her neighborhood association, had some really good ideas that we could start bringing in. And improving the access to affordable transportation and delivery services. The program at Advocap really has been able to step up and cover not all of the needs, but certainly meet many of them. One of the drawbacks to that one is when people hear that they have to contact the ADRC first to be enrolled in that particular program, that's off-putting to them. But once they make that move and start getting linked up with Patty Micah and her volunteers, or, with that, people seem to be really happy about it and the fact that it provides transportation out of town.
Why is that off-putting, Judy?
It's government.
Yeah, so that speaks to the connection that was made up there. People worry that if they start interacting,
Yeah.
there'll be negative consequences.
Correct.
Okay.
Or that they're going to have their driver's license taken away. Well, I'm sorry, and I know we're all of us going to reach some point, but many people should not be driving in the first place because of their physical limitations, or as some of us have seen, with their memory issues. And how many times do we see those silver alerts, which has been a very positive in finding people sooner. I admit that I was so relieved when my parents moved back from Forest County back down this area, because as they got older and my dad loving to go for drives, he could have gotten lost in the woods, and especially when his neighbors were passing away and it was just him and Mom in that area, a lot of bad things could have happened. So it just kind of bothered me more. So that would be just part of it. But again, it's a really good asset that we have to the community, resource that we have to the community that we didn't have before. The fact that they go out of town, which is different from using the cab. And so that, creating community design and policy that supports age-friendly community. Again, we've got some progress going on that, and that would be the collaboration that's been going on with ADRC and the Senior Center to an extent, and some of the other groups. Long ways to go. Improving the communication and visibility of available services to seniors. And that's one thing that we have, as a committee, I think we've made some progress there too. Having, at the time that this was put together, our meetings were not all televised. And now our meetings are televised. We're not sure necessarily how much viewership we have, but people are commenting. And again, we as a committee have been part of like the Senior Expo, the diversity program, some of the diversity programs. We've been bringing more groups to us as speakers who then go back and talk about what they've seen or heard here in our meetings. But we still have a long ways to go. And there's some really good ideas that are going to be presented over the next few months. And then improving access to home services is not what we were addressing in that original 4. But the health department, again, pre-pandemic, put together a list of various volunteer as well as paid services to cover many of the home improvements, safety. There was the program with Steve Kaiser that actually provided free services. And as he moved a little further in his retirement, that kind of went by the wayside because there were other, like Rebuilding Together, programs coming in place that had greater support. So that's just kind of a quick overview, because I'm looking at the clock here too. But looking for some opinions, questions, suggestions. And Julie, you want to start?
Sure. I mean, when I look at these initiatives, I think they're kind of on the right track, but when I looked at the breakdown that was sent out of like what our actual, things we were going to achieve, some of them were a little lofty for a committee that meets once a month on a volunteer basis, but it's not at all bad to start, I think, with that plan and revisit it, I think, for an update. That would be my suggestion.
Well, we just got an email from Ray Mauer. So the city is going through another strategic plan, and the park department is looking into, because we ended our strategic plan before COVID, is to go through another strategic plan process. And then he is going to look into having the Committee on Aging possibly go through another strategic plan. So the materials that you received, the plan was 2017 to 2019. So a lot of good things through all of that, again, like Julie said, but I think possibly waiting to see what Ray comes back with to try to figure out if it's a formal with a facilitator or if it's just the group. I guess that's up to you guys. So the offer is out there to kind of see if there should be another formal with, like I said, with a facilitator. So it's up to you guys.
Yeah, I mean, I think, just get from my opinion, I think that's worth doing. As you mentioned, with the city, we had our first strategic planning session doing a new plan. I think it makes logical sense for all of our boards and commissions to do the same thing. And yeah, if we can bring in somebody to actually facilitate, I think that's always helpful.
So it may be a bit, but it depends on the finances and everything that will occur, so.
Okay, Pat, you're the newest one on the block.
I am. Well, just from what I'm hearing and when I kind of glanced through all this stuff you had given me, I'm thinking it's going to be trickling down and everybody's going to have to do a new strategic plan. And so putting off until we find out what they want from us. If they're going to give us a facilitator, like you say, that helps focus what our needs are. And post-pandemic, needs are different a lot. I mean, there's some basic ones that are still needed, but it certainly has changed. Our way of doing life is different than it was pre-pandemic, so.
Heidi?
I know Julie and I had talked briefly about, we have in our MPA program a strategic planning course, and we have students that do an independent project like this for their capstone. So there's a possibility there too, if that's something that we wanted to take advantage of.
Oh, yeah, that would be good too.
And,
Maybe if you want to touch base with Ray just to kind of.
Yeah, I can certainly do that.
and that would certainly save on the budget.
Right.
And it would be a great collaboration, intergenerational,
Right.
which is good for both sides
100%.
of the project.
100%. Oh, yeah, no, and our students are always looking for, right, resume builders too, so that's a good thing.
My only other concern is, one of our main initiatives is to advise the city common council on recommendations, and I'm wondering, have we ever done that? And is like the program that we just saw one of those great things that we should be thinking about providing more advocacy to?
Before we
And,
have,
and how would we go about doing that, I guess?
Yeah. Okay, again, Jean and I can speak back because we're the early years. We used to submit once a year a letter to the council that said what we'd accomplished during the year. And then we started having a council rep, and that council rep was theoretically sharing that information back to the council, that it's being done on a regular basis, so that we have not formally, as the rest of the group, been doing that letter or that report. Do we need to go back to that? Is that something the council would like us to be doing?
I think it'd be a good idea.
Okay.
Right, we always have right at the end of our meetings, a few minutes where we can report on what's happening in the boards and commissions, but I think it's much more powerful and much more likely to be acted upon to have something formal that's actually submitted.
Okay.
We also, as part of the public comment, part of it was if somebody brought something to the Committee on Aging, and an example would be, we might need handicap ramp somewhere in the city, off a sidewalk scenario, then we would make recommendations to the city to make that happen. So we're kind of just like a board that then just funnels the information, so off of somebody's need, public comment, et cetera, wherever it comes in. So-
Okay, 2 points on that. Wheelchair ramps is a biggie, and that has to go back through, I believe, planning and zoning, and there's so many hoops. And Larson Winchester Lions Club does not do ramps in the city of Oshkosh because of all of that. And I know that there is several families have been looking into things, but one woman in particular has been very vocal recently on several social media platforms about the difficulty in having a ramp installed at her home to get her husband out of the house. And
It's an issue with planning and zoning is what.
I'm not sure of the whole process, but, there's something in there of, people they can't even get the permits for it. And if Larson Winchester Lions Club has kind of thrown up their hands, there's a big stumbling block there. And then I've heard from some folks that live at, what is it, Ralph Place now? Used to be Mainview, name change, of the quality of some of the sidewalks in the downtown area there, that they're usually going back and forth. And again, that is sort of a maintenance issue, and we keep telling them, all right, you need to contact this place or that place. We can't do it all for you. We can bring it back up, but, you still have to be a part of it, and it can't be hearsay.
No, that's good. I'll bring the wheelchair ramp. We have plan commission tonight.
Good.
I'll ask about that tonight, because, yeah, I was unaware of that. That's not good.
Oh, that is huge.
Yeah.
It
And,
depends on the code, whatever.
yeah,
the
and how
code
much
is for
space
the
there
city.
is, and, I mean, with ADA, it's so many, so many inches per foot distant, inches up per foot. I don't remember all of it, but, so that's why you see the zigzag going. And I was told that, to me, then it becomes hearsay, but I was told somebody tried using like the automotive ramps, and whether they were censored or fined, I don't know. But I know my son-in-law in Ohio uses those to get his dad in the back door at their house. But that's Ohio, that's not here. And it was only like a couple of steps. But there's a lot of things that families are trying to do to have the homes accessible. One of the things that could also be looked at in talking and planning, homes that are under building codes, doorways sufficiently wide for wheelchairs to get through, wheelchairs and walkers. Light switches, instead of the little toggle switch, the wider switch. The door handles rather than the door knobs. How many of us look at that now and think that that's just the way it should be? But those are simple things that save a lot of dollars. A few dollars extra in the front saves a lot of dollars in the backside.
Yeah, and this is a great example of something, right? When we talk about a formal recommendation, a list of these or things that we see as barriers to accessibility in the community. I think that's a place we can have a real impact.
And so, those are things that we have talked about. I mean, I go back, again, I'll use my household as an example. My husband was a bilateral leg amputee, swore he would never have to have a wheelchair, would never have to. Well, as he was building in with our home, he put stairs in certain areas. And as years went on, he was more limited to certain areas of the home because he couldn't reach other areas. And I see that. Now, Julia's worked with my one aunt and uncle, and that home was not as accessible as some. And that was an old farmhouse that related back to the 1800s. So there are a lot of things like that. So as we look at new ways, new construction, new, even just neighborhoods, and maybe a little more green space versus all the concrete, or better quality paths, in the walking trails. Those are things that we've been hearing a lot about as people are getting back out, or even, through the pandemic. Because they've been confined to the home more, or even looking at what they're doing outdoors. So,
I will say one thing I've been impressed with as our city has been redoing parks. Making parks more accessible is a huge issue for families who have children with disabilities or or if the parent is the one. So that's been a huge improvement, and I know that Port Place is extremely expensive, and I'm glad we've made those investments. It really makes our city more accessible.
Yeah, the city just went through an ADA audit, and they looked at everything. And so we had gotten a report on what areas needed to get improved, and which were all very good. So that audit, I think, was very valuable for the city, so.
well, and you go back to, the 70s and 80s again with the ADA and the just uproar over curb cuts. And why should we have those for just this little population? And now, how many people are upset if there is not a curb cut? So they benefit. We look at these things in terms of what would benefit the elder but they also benefit a much wider range, be it people with disabilities, kids riding their bikes, families with the babies in the strollers, so many different things. So I think the more we can, my personal opinion, the more we can explore these things, the more impact that we're going to be able to have as a committee.
Just to touch on number 3, the create community design and policy that supports an aid-friendly community. That process is in the works. It's a 5-year plan, and I do believe it's into maybe a year and a half already into it. The ADRC, Mark Weisenseld started the process. The Committee on Aging was going to start the process, so when we found out that we were both going to do the same thing, we got together and said, let's do this together. So right now, it's in the hands of the ADRC, and a survey did go out, so part of a lot of the process has already started, and I think maybe along the line, I do believe we should probably, again, bring the ADRC and give an update on that.
Right.
So,
Right.
so that one is in the works through ADRC.
Okay, they are on our list. Any other comments? Otherwise, I'm looking at the time. New business, I think we kind of covered, that was all the same thing here. Other business, a real quick around the table. Julie?
I can just announce that Learning and Retirement's fall catalog is out, and classes begin in September, so this is a great time to join LIR.
Thank you. Julie?
I don't have anything.
Mike?
Is there any, we were told to ask the boards and commissions if we're still happy meeting in person, or if people prefer virtual, or something else, some sort of hybrid. So just, you don't have to answer right now, but give it some thought, if you prefer meeting in person or virtual. I know last time everybody said they preferred in person. I'm reading the room, I think that's still where people are at. But I said I would ask, so I asked.
I think we all pretty much do agree, and dealing with WebEx, a lot of times we were getting either a lot of static, pixelating, everything. It was
Audio issues.
Oh, yeah.
Right?
And trying to conduct a meeting was horrendous.
Can't read body language, it's brutal.
Absolutely. And I was trying to conduct a meeting, and Ron was at home, and we were texting back and forth because sometimes he could hear things that I couldn't hear. I don't multitask that well.
All right, sounds good, well, thank you.
Pat?
Well, in person is my preference. Thank you for inviting me. This has been very, very enlightening. It's like, I got a lot of work ahead of me.
Heidi?
I do have scams prepared for today. I'll just hold that up to the next meeting due to the time constraints.
Okay, thank you. Jean?
And just so you guys have our newsletter, and today, the Del Rays are being hosted at the Leach today, so if you want to come and attend that, it's $8 at the door. And our last Food Truck Friday is in August, it's on the cover, August 14th, 15th. You're welcome to come to that, too. 19th.
Okay, from Joanne. She's going to be teaching a Tai Chi class on Thursdays from 1:30 to 2:30, starting on August 25th at 206 State Street, which is the new mental health substance use drop-in center. And, okay, and then if anybody has forgotten, we need to dial 920 when we're calling locally because of the 988 suicide crisis lifeline that started in July. So that's why sometimes you have trouble getting your calls through. And then just one last thing, and I'm not even going to go into detail. The Wisconsin Office of the Commissioner of Insurance has issued a nice checklist for people when storms come through, like we've been dealing with recently. And an area out by Borth got hit twice in 1 week with power outages and trees down. And then the storm that went through a week ago that hit here in Oshkosh. So with that, Our next meeting is, I have my, September 6th, and we'll have that speaker announced later. With that, I'll take a motion to adjourn.
So moved.
I'll second it.
All those in favor?
Aye.
Aye.
Meeting adjourned. Thank you, everyone.